Well, that was Dr. Willem Kize a little bit earlier on this evening. Now, Professor of Vaccinology at the Wits University, Professor Shabir Madhi joins us now for some insights on how South Africa is faring so far in this battle against COVID-19. Prof, thanks very much indeed for joining us. Welcome to the program. We keep saying these statistics every single day and getting a sense of how the pandemic is growing and moving. We saw it first in KwaZulu-Natal, then it moved to Gauteng, and the epicenter now appears to be the Western Cape. What trends have you been able to see, track, and interpret from the data that's come out so far?
So good evening to you. So I think what we need to do is we need to be cautious in terms of just taking the numbers at face value. One of the realities right now is that the Western Cape is a province that is having the highest testing rate in the entire country. Roughly about 60% of all of the tests that are being done in the entire country are just being done in the Western Cape. So it's not surprising that the province that got higher number of tests being done are going to be detecting more cases. So that's the first issue. So yes, the Western Cape might have an excess of cases compared to the rest of the country, but it might be a function of the number of tests that are being done. So unless there's equal amount of testing that's being done per capita of the different provinces, it's really difficult to quantify exactly where the hotspots are and how one region is affected compared to another. That being said, the reality is that even currently at just over 8,000 cases, we're still at the very early stage of the epidemic. And in fact, I think what we need to recognize is that there really is no stopping the spread of this virus. The virus, unfortunately, is going to infect individuals. And that is a universal phenomena. It's not something that's going to be unique to South Africa. Our challenge is to ensure that the rate at which people get infected is drawn out over a longer period of time, because that will assist us and especially assist our healthcare facilities in terms of coping with an increase in terms of the number of individuals that are going to require hospitalization. So Prof, we're still at a relatively early stage of the epidemic.
Prof, why is it that we can't stop it? I mean, if we can slow it down, isn't there a way that we can prevent infection?
Yeah, so unfortunately not. The reality of a respiratory virus is that it's fairly easy for it to transmit. And that's the reason why you see these massive outbreaks, even in highly resourced, high-income countries. You're seeing large outbreaks. And that's the reality of a respiratory virus. Its efficiency in terms of transmitting from one to another person is much greater than, as an example, HIV. So HIV is a virus because it's basically transmitted largely because of bodily fluids, and close contact or immediate contact with such bodily fluids is something that you can actually prevent if you avoid those bodily fluids. The reality of respiratory viruses is that they're essentially all over the show. To some extent, they're in the air, but they contaminate a whole lot of surfaces that people come into contact with and end up self-infecting and end up infecting themselves. So it's really much more difficult, if not almost impossible, in a majority of settings, to be able to really completely eliminate. You certainly wouldn't be able to eliminate the spread of a respiratory virus.
All right, so we can't stop it. What's your projection then going forward? How many people are likely to get COVID-19 as it gets to its peak?
So I think the reality, what we need to understand is that with this respiratory virus, what we expect to happen over a period of 2 to 3 years, we expect up to 2/3 of the population in South Africa and in every other country that isn't able to stop the circulation of the virus being infected, up to 2/3 of the population. But those 2/3 of individuals that are going to be infected, roughly about 70% of them will actually have no symptoms. They will not know that they've actually been infected. Of the remaining people that are actually infected and that are symptomatic, which makes up about 1/3 of the people that are actually infected that become symptomatic, the majority of those, 85%, will basically have very mild self-limiting symptoms. So they could pretty much just stay at home for a few days to feel well. You might need to take some Panado as an example. It's the other 15% of individuals that end up with severe disease, who are usually really composed of those individuals with underlying medical conditions, people over the age of 65 as an example. as well as people with hypertension, diabetes, obesity, is that group of people that end up in a hospital. So if we put all of this together, what I'm really saying is that if you take 1,000 people older than 18 years of age, of those 1,000 people, roughly about 26 people will require hospitalization. And of those 1,000 people, about 5 people, unfortunately, will die. The majority of the people that will die, the majority of people that will require hospitalization are people older than 65 years of age, are people with these underlying medical conditions. So that is to put a context, but there's really no getting away. But up to about 2/3 of the population being infected, it's just us wanting to spread the period of time over which 2/3 of the population become infected. So our healthcare facilities don't need to deal with a massive surge of cases over a narrow period of time, which will collapse the healthcare facilities.
All right, so picking up on what you're saying, that a lot of people will probably not even realize that they've got COVID-19, it will come and it will go. Does that mean that we have no idea how many people right now have got COVID-19 in South Africa?
I'm sorry, you broke up there.
I was just saying that you said earlier that a lot of people are going to get COVID-19 and it will go into their system and leave and they won't even know. Does that mean right now we have no idea about the numbers of people that have got COVID-19 in South Africa, and that these statistics perhaps are not telling the whole story?
Most certainly. At the best, these numbers that we actually identify, the cases we're identifying at the moment, doesn't represent more than 10% of all of the true number of cases for a number of reasons, because we're not really doing the number of tests that we should be doing. And as I mentioned, more than half of the people that are going to be infected are not going to have symptoms, and there's no way that any country in the world can actually look and test for those people that are asymptomatic, because it's not just a once-off test that you need to do. You pretty much need to be doing it every 3-4 days almost on every individual in the country, which obviously is not feasible. But the other major problem that we face in the country right now is that when we hear about 400 new cases have been diagnosed yesterday, it doesn't mean that those were individuals that were tested yesterday. A big challenge that we face in this country, like many other countries, is that it's taking anything between 5 to 10 days for a result to come back after someone has been tested. Now, that has got huge implications. And in fact, to some extent, it makes testing a worthless exercise. And the reason for that is that, as an example, in a healthcare facility, you need to get a test result within 12 to 24 hours to decide how to manage the patient, to triage the patient to a specific facility, so there isn't too much, so there's a sort of additional caution that has been taken in terms of the care of the patient, so we don't end up having healthcare workers infected. So that's in a hospital. In the community, when you test, the reason you're testing an individual is to identify an infectious case, and then you need to trace their contacts. And you need to trace the contacts from about 3 days before they became symptomatic up to the time point when they've been tested and gone into isolation. Now, if you delay a result for 5 to 10 days, basically what's happening is that that infected person has infected more people because he hasn't gone into isolation. What that person, by the time he gets a result, he probably is no longer infectious to start off with. And the number of contacts that you would need to actually follow up on is closer to 20 for each day. So over a period of 6 days, you would need to probably follow up at least about 120 close contacts per person. Now, for you to be able to control the spread of the virus, you need to be able to follow up at least close on to 90% of all of those contacts. Before the lockdown in South Africa, we weren't able to actually follow up even 20% of all of the contacts. So yes, we are doing testing, we're finding more cases. But the reason we're doing the testing is not just to find cases. The reason we're supposed to be doing the testing is to be efficient in terms of the isolation of those individuals in as short a time as possible after they've been presenting for testing, and to be effective in terms of tracing the contact. So what we need to be reporting on in the country is how many of these tests are being done, and how many of the results are coming out within 24 hours, and how many of the contacts are being traced, and what percentage of those contacts are going into quarantine. And that is how you're going to slow the rate of spread of this virus. You're not going to slow the rate of spread of this virus just by doing testing and getting a result 5 to 10 days. Effectively, you shouldn't be testing if you're getting a result 5 to 10 days later.
All right, so from what you're saying, it seems almost impossible to get the testing rate and tracing rate to anywhere near what is required. Are we then looking at a situation where we kind of accept that this virus is going to move, it's going to move quickly, and we've got to do the best we can in terms of managing those people that need hospitalization? And I guess maybe what I'm saying is, do we prolong the lockdown?
We certainly don't prolong the lockdown. The lockdown is not sustainable from multiple fronts, including actually probably it's going to end up causing more excess death from non-COVID illness than from COVID disease. So we find that people are no longer presenting early enough to be diagnosed for TB, which means the outcome of those individuals is likely going to be worse. So we're going to end up having more TB deaths eventually than should have occurred in the absence of a lockdown. As an example, children are not being immunized, right? The rate of immunization is falling in this country. Children are going to become susceptible to dying from pneumonia, to dying from diarrheal disease, despite them not actually being at risk of dying from COVID, right? We've heard about the economy and the damage that the lockdown is doing to the economy. So we cannot afford another lockdown on multiple fronts. The only way that we can actually reduce the rate of transmission of this virus, right, is for citizens of the country to be responsible in terms of ensuring that they adopt the non-pharmaceutical approaches that has been recommended. Things such as wearing a mask, things such as social distancing, avoiding overcrowded situations, hand hygiene. Those are the fundamental things which will allow us to reduce the rate of transmission of this virus. Government can come up with any policy. That policy becomes meaningless if the citizens of the country aren't actually in agreement and don't actually adopt the type of interventions that are actually being proposed. Lockdown is not one of those interventions. A lockdown was never going to eliminate the virus from this country.
All right.
Going into another lockdown will certainly not eliminate the virus from the country. So it's really controlling the rate of infection.
All right, so until a vaccine arrives, and that's maybe a year and a half out, are we going to see these figures go up and then peak, and then it'll just be a steady stream over time?
Yeah, and that has been an experience in many countries. So we're probably projecting that at some stage in the next 2 months or so, we probably will get as much as between 6,000 cases per day. If we continue testing, eventually we might actually just stop testing for all intents and purposes, because it almost becomes meaningless to be testing if you're not going to be acting on those results, especially at the level of the community. For the hospitals, it's a different story. Now, the other thing we need to accept is that this pandemic is not going to be with us for 6 to 9 months, right? This pandemic is going to be with us for at least 2 to 3 years, right? And we're going to see waves. This is the first wave of the pandemic, right? And we're probably going to see another 2 to 3 waves before about 2/3 of the population become infected, at which stage we expect what we call herd immunity to arise. And then for every one person that's infected, that person is not going to infect, it's going to infect less than one other person. And that's when it goes into a stable state. But that is only going to evolve roughly after about 2 to 3 years, depending on how effective we are with our non-pharmaceutical interventions that we talked about. It might be that we get a vaccine sooner. And if we're able to get a vaccine sooner, we can sort of accelerate the timeline in which we're able to achieve herd immunity, which makes it more difficult for this virus to transmit, especially to people that are still susceptible to developing severe disease.
All right. Prof, we're going to have to leave it there, but thanks very much indeed for those sobering thoughts. And again, I guess the message really is that every citizen actually has to be responsible for themselves, and at the same time meaning that they'll be responsible for others. All right, that's Professor Madhi, who's with the Department of Vaccinology at the Wits University, speaking to us about the COVID-19 situation. And as you've heard, it looks like it's something that we're going to have to accept is going to be with us for some time. And over the next perhaps 2 to 3 years, more than 2/3 of us will probably get the virus, but most of us won't even know. It'll come in and out of our system, and a small percentage of people will be the ones that will be symptomatic, and an even smaller percentage, sadly, will lose their lives.